I'm Mino-Kenudson. I'm a director of the pulmonary pathology at Massachusetts General Hospital in Boston and associate professor of pathology, Harvard Medical School in Boston. So because of tissue size, which is very small, when minimally invasive endobronchial technology brings us, and because of personalized medicine for lung cancer patients requires multiple tests that we have to perform, the combination of a small size sample and multiple tests we need to perform, that brings very complex situation to the pathology field nowadays. For instance, we have to do appropriate histologic subtyping for histology-directed therapy and molecular testing to detect targetable mutations and PD-L1 immunohistochemistry to select patients for immunotherapy. So there are multiple tests we have to do, but we have only limited small size samples. So we have to think how to prioritize the tissue for multiple tests. They have to minimize the tissue waste to cover multiple tests. So again, we have to do multiple tests by using the very small size samples acquired through the minimally invasive endoscopic technologies. But those appropriate tests actually influence the patient's fate, right? If patients are diagnosed to have EGFR mutations, sensitizing EGFR mutations, patient will be able to treat it with EGFR TKIs. If patients diagnosed to have increased PD-L1 expression, over 50% of tumor cells harboring the PD-L1 expression, then patient will be treated with the pembrolizumab as a first-line therapy. It can give the patients very durable response. Then patient will be very happy, right? So we should not miss the opportunity to give the patients with the effective treatments. So we understand importance of the tissue handling in order to conduct multiple tests. However, practice pathologists, meaning non-academic pathologists or non-specialized pathologists who are not specialized to the lung cancer in the field, they do not understand the importance of multiple tests which are required for the management of advanced non-small cell lung cancer patients. So challenge would be for us to convey the importance of those biomarkers, multiple tests, by using the small size biopsy samples. So there are two issues. One is that to educate the pathologists who are not in the field or private practice pathologists with the multiple educational sessions and to just convey the importance of those sort of issues. And secondly, well, nowadays there is a development of liquid biopsy, right? So the liquid biopsy, although we cannot differentiate adenocarcinomas from the squamous cell carcinomas by liquid biopsy because we do not have reliable markers can be used. However, in terms of the biomarkers, such as mutations, even fusions, we may be able to detect the with using the next-gen sequencing applied to the liquid biopsy or the plasma DNA. So currently, the sensitivity of the plasma-based the testing is not great, but every single moment technology is advancing. So in the near future, we may be able to cover multiple tests using the liquid biopsy. So then patient will benefit from that.